so I'm going to be doing the tracheostomy care for this video, and I'm going to be starting now. So I'd be following the facility policy on tracheostomy care, and I'm going to be now going into the patient's room. So knock, knock, knock. Hello, my name is Vado. I'm one of the nursing students working in this unit today with your nurse. Can I please have you verify your first and last name and your date of birth? George Patel, 10/17/55. Thank you very much. So the reason for my visit is because I'm going to be cleaning your tracheostomy. Do you have any questions about that? No? Perfect. Because I know that you've had this done before. I just wanted to make sure you didn't have any questions. Are you having any pain? If you are, can you rate it from 0 to 10? 0 being no pain, 10 being the worst pain ever. 0 pain? Perfect. Also, I'd be noting that my client has everything that I need to provide this tracheostomy care by the bedside, so I have that available to me. Also, I'm monitoring my client's oxygen levels and making sure, because they have a pulse ox on them, I want to make sure that I'm also seeing their oxygen levels as I'm providing this care. So I'd be raising the bed, moving the head of the bed, making sure that my client is in a good position. Also, their neck is well supported and everything for this procedure. So that's really good. I'm going to be getting a clean, dry towel, putting it on the patient's chest. And from here, I'm going to be then putting on gloves or any PPE if necessary. Okay, from here I would be removing their O2 collar, and I would be removing the dressing, the old dressing, and I'd be assessing for coca and making sure that I take note of what I'm observing. So from here, I'm going to be removing my gloves and hand hygiene. Perfect. Also to note, my client has recently been placed a new inner cannula the last time that it was cleaned, so it's fairly new, and we're not going to be discarding this inner cannula. We're going to be reusing it for this procedure. Also to note that my client does not have a metal inner cannula. If they did, I would not be using hydrogen peroxide for this procedure, but since they don't, I'm allowed to use hydrogen peroxide, and I'm going to be using half hydrogen peroxide and half normal saline for this procedure. So from here, my workstation has been cleared off and has been disinfected well to make sure. So from here, I'm going to be then continuing my procedure. So I'm going to be I'm going to be loosening the cap for my normal saline, and if I had hydrogen peroxide here, I'd also be loosening the cap for that one. So from here, I'm going to be opening this up. Okay. And I'd be moving that a little bit over. I'd be getting this right here. Okay, and I'm going to be placing it on my client's chest. Perfect. So from here, I'd be opening up my sterile gloves. Perfect. So from here, I'm going to be moving this little tray. Okay, moving it right over here. I'm going to be removing these gloves because I'm not going to be using them. Okay, from here, I'm going to be pouring in the normal saline, and half of it would be hydrogen peroxide, half of it would be half of it would be hydrogen peroxide and half normal saline. The other one would just be normal saline. I'm just going to cap it really quickly. Okay. From here, I'm able to put on my other sterile glove. Okay. Okay. So from here, I would then grab this right here, put it there, get one of my gauzes and make sure that it's moistened, and that's good. Put it on the side. I'm gonna get my little Q-tips. I'm gonna be moistening them, that's good, and putting them on the side as well. Okay, so from here, I am going to then go over to my client's inner cannula, and I'm going to be using my non-dominant hand. It's going to be contaminated, so it's going to be just a clean glove now. So I'm going to be then grabbing the inner cannula and twisting it to the right direction and making sure that I follow the right curvature. From here, I would have also removed the O2 collar, and then I would remove the O2 collar as I removed before I removed the inner cannula. From here, I'm going to be then putting it in this solution right here. I could let it soak for a little bit if I needed to. From here, I'm going to be grabbing it, and I'm going to be using my sterile glove to grab this part right here. Okay, so from here, I'm going to be then cleaning inside, and I remove it and put it there. From here, I'm able to then drop it into the saline solution right here and make sure that it's clean. From here, I'm able to use these right here to try to clean the inside. So I'd be cleaning the inside well. Drop it. The inside well right here. And drop it. And if needed, I can use a gauze to just dry the outside. Okay, so from here I'm going to be going over to place in the inner cannula, and I'd be following the right curvature and locking into place. And so now that that has been placed in correctly, from here I'm going to be then grabbing my little Q-tips right here with my sterile hand, and I'm going to be grabbing on to the cannula and making sure that I'm cleaning around, making sure that it is well cleaned off, moving outward. And then going in for this one, remove that for a second, grab this one, I'd be holding on to it and cleaning around, making sure that's good, or maybe cleaning the other side as well. Okay, and from here I'd be grabbing my moistened cloth, my moistened gauze, and from here I'm able to then grab onto it again and then clean around. And then I'd go around. Okay, that's good. I use my dry gauze and make sure that it is well dried. That's good. And from here, I'd be using my sterile glove, and I'm going to be putting on a fenestrated gauze for this patient. So I'd be going in and making sure it's going to be a little difficult with the bottle, but I would be putting it on and making sure that it is well secured, maybe even tugging a little bit on the sides and make sure that it's well secured for that. So from here, if I needed to change the ties for, I would then change it, but these would be fine. Also to note, if I did have to, I would not remove both sides at the same time. It is best to only remove one side as you're working with it, or you could use what the ATI video said and put on the new one and then remove the old one so it's still stable. So since that is already good, everything has already been done. So from here, I'm just going to be cleaning up my station, throwing everything away, taking off my gloves. And I'm going to do hand hygiene, or I would wash my gloves. I would then be making sure that I'm looking at the oxygenation of my client, making sure that it's fine, putting on the O2 collar, and their oxygenation is fine. I would also be assessing the client, making sure that they're doing good. And from here, I'm going to be then moving their bed down. From here, thank you very much, Mr. Patel. I have it all done. So now I'm just gonna place your call light on your left-hand side. If you need anything, please press the call light. Thank you very much. And from here, I would then hand hygiene, close the doors, and then from here, I would be documenting my findings. So I would be documenting the COCA of the secretions, the assessment that I did on my patient, vital signs, and also how my patient took the procedure. Thank you.